We have a lot of things that are new with the HPV vaccine in the past year. In March of this year, the Advisory Committee on Immunization Practices extended the recommendation for the HPV 9 vaccine, the 9-valent vaccine, which is trade name Gardasil 9. So now the official recommendation for all kids ages 11 and 12, both boys and girls, is for 3 doses of any of the HPV vaccines. So we have a choice of the HPV 2, which is Cervarix, or HPV 4, which is the original Gardasil, or HPV 9, which is the newest Gardasil. The great thing about the new vaccine is that it extends the coverage for the cancer-causing strains of HPV. It extends it by adding 5 additional strains, and so now we know that we're going to be protecting our young people against the strains that cause, well, it's 9 strains, and the strains that cause up to 90% of cervical cancers. There's been a great deal of talk lately about vaccines and about combining vaccines and changing schedules. The nice thing about the HPV vaccine is that it is not a live vaccine, so we don't need to worry about combining it with another vaccine. It's okay to do that. The schedule is for the initial vaccine on day 1, and then the second vaccine comes at 1 to 2 months, and the third one is at 6 months. If that schedule is interrupted for any reason, that's okay. You don't have to go back and start over. You just continue forward. Also, a bigger issue, since now we have this new extended vaccine, if you have started with, say, the previous Gardasil vaccine for the first shot, can you switch to the Gardasil 9? Absolutely, and you don't have to go back and start over. Now, we don't actually have extended information for efficacy of those additional 5 strains if you only get, say, 1 dose of the Gardasil 9 in your series. So we don't have that information yet, but what most clinicians are doing at this point is just switching over and finishing out the series with the Gardasil 9 if that's available. How do you talk about this vaccine with your patients, and probably often more importantly with their parents? We have to remember this is an anti-cancer vaccine. It is fabulous that it also protects against the 2 strains that cause 90% of genital warts, and we do have over 1 million cases of genital warts per year in the United States, so that's a pretty big deal. But the most important part, the life-threatening part that we're trying to prevent, is cancers. And there are over 30,000 HPV-related cancers per year. Yes, half of them are in women, and they're cervical cancers. We still sadly have over 4,000 deaths per year of cervical cancer, and this is a preventable disease, largely preventable. So there's cervical cancer, there's anal and penile cancer, which are less common but obviously still out there. And then we have a little bit of an unknown. We have about 13,000 to 30,000, depending on what studies you look at, head and neck cancers per year that are HPV related. And what we hope to see in the future is that those numbers come down as we increase prevention.